Imagine this, you're typing on your phone, cooking a dinner, or just holding a hand of your child, and then you feel a sharp shooting pain in your finger. This sounds familiar, right? Let me tell you something. You are not alone in this. This nightmare is called paronychia. Hello everyone, myself Dr.anjalideep, and today we are going to talk about on paronychia. We are going to take various questions in this video so that we can clear your doubts and you can choose your options wisely. In this video, we are going to talk about what is paronychia, why your nail is swollen and painful, what exactly causes paronychia, can these acrylic nail causes paronychia, is there any difference between acute and chronic paronychia, is it a serious condition or I can be at home and take care of this by myself, is there any other solution other than antibiotics, is there any tips or tricks or home remedies for this condition, is there any role of homeopathic medicine in this condition, how much time will it take if I start homeopathic medicine today for this complaint? Well, all of these questions will be answered in just one video. So stay tuned in this video. Also, one more important thing that the timeline which we are going to tell you कि कितने टाइम में आपको होम्योपैथिक मेडिसिन लेने के बाद रिजल्ट मिलेगा, वो एक्चुअल रिसर्च पेपर्स में से लिया हुआ डेटा है और मेरी ओपीडी का क्लिनिकल डेटा है. So stay tuned till the end. Hit that like button if you are also dealing with this nail pain. What is paronychia? Paronychia is an infection, or you can say inflammation of skin fold surrounding the fingernail or a toenail, the area right around the cuticle. It happens when bacteria or other germs sneak in through the tiny cut or damage the skin. That innocent hangnail or pushed back cuticle can open the door to real trouble. Now there are various questions related to this condition. The most common question is why my nail is swollen and painful. Well, let me tell you this. This has happened because the protective barrier around your nail has been breached. Your body rushes immune cells there, causing swelling, redness, heat, and that relentless throbbing. It feels like your finger has its own angry heartbeat and it is trying to tell you something is wrong. Keep watching because we are about to cover exactly what causes this and how to stop it so that you can have less trouble. यहाँ पर common causes हैं minor trauma होना जैसे कि a small cut, aggressive cuticle pushing or even constant exposure to water and chemical that dry out and crack the skin. These are few main factors. Now the next most common question is, can acrylic nail causes paronychia? Well, the answer sadly is yes. The glues, filling and lifting of artificial nail often damages the seal around your natural nail, inviting the infection. Other triggers are frequent hand washing, like in healthcare workers or the new parents, in diabetes patients, or due to poor circulation. Well, paronychia has basically two types, acute and chronic. The major difference between acute and chronic paronychia are these. Acute paronychia hits fast, within hours or days. It usually bacterial, super painful, often with pus and affects one nail. In chronic paronychia, sneak up slowly over weeks. It often linked to repeat irritation or fungi, can affect multiple nails and cause ongoing swelling, cuticle loss, and changes in your nail. Well, acute feels like it is an emergency and chronic feels like it is frustrating, never-ending battle. The next common question is paronychia contagious? The good news is here. Paronychia itself generally non-contagious from person to person, but the bacteria causing it can spread if you share towel or tools with an open wound. Now, let's move toward the next common question. People usually ask, does this paronychia go away by its own? Well, the answer is mild cases can improve slightly by their own, but mostly you need a help, especially if pus develops. Next question is it serious? The answer is it can be. If pus develops Untreated acute paronychia can turn into deep abscess, spread to the tendon or bones, or can cause permanent nail damage, and in chronic cases, drag on and destroy nail appearance and function. Don't ignore the fear. Listen to it as a warning. Picture your hand getting worse, spreading redness up to your hand, fever. Scary, right? But there is the turning point. Next common question is, when should I see a doctor for paronychia? Consult a doctor immediately if there is significant pus, fever, red streak, worsening of pain after 2 days of home care, or if you have diabetes or weakened immune system. Better safe than dealing with complications. Well, the next common question is, does paronychia is treatable without the antibiotic? Well, the answer is yes. Let me tell you some tips which can help you to reduce the symptoms. But yes, you will need a proper consultation for this. So, here is the good news. Many mild cases respond beautifully with simple natural approaches. Start with warm water soaks 3 to 4 times a day for 15 to 20 minutes. This increases the blood flow in that area, reduces the swelling, and keeps your body fight the issue naturally. Also, remember one more thing. Keep that area dry and clean between the soaks. And most importantly, avoid further trauma. No nail biting, no pricking, and protect them with gloves from chemicals and water. Well, let's talk about, is there any scope of homeopathic medicine in the cases of paronychia? So here it is what homeopathy does. Homeopathy works by supporting your body's own vital force and healing intelligence. It addresses the individual pattern of symptom, the type of pain, the timing, the emotional stress it causes, to gently stimulate the recovery from within, rather than just suppressing the symptoms. It aims to restore balance so the inflammation resolves more completely and reoccurrence drops. Many people find it helpful to reduce the swelling and pain effectively while supporting the long-term nail health without any need of conventional drug in suitable cases. Always consult a qualified homeopathic doctor for personalized guidance. You can also contact us. Contact details are given on your screen. Now comes the most important and common questions of the patient. कि मैम कितने टाइम के अंदर हमको ये डिजीज कंडीशन के अंदर रिजल्ट मिलेगा? Well, we have collected the data from all the research people publish on this topic, and according to those data and my clinical experience, it usually takes in acute cases few weeks and in chronic cases from 1 month to 6 months. So the time period is very less, but the result is long lasting. So I must say you should choose the option wisely. I think you understand. You don't have to live in that fear anymore. By understanding paronychia, acting early, and supporting your body's natural healing with soaks, protection, and holistic approach like homeopathy, you can regain the comfort and confidence in your hand. If this video finds helpful to you, share it with someone who is still struggling with this. Drop your comments in the comment section. What worked for you in this condition? Subscribe our channel for more such empowering health and homeopathic truths. And remember this thing, your body is resilient. But listen to the warning, take action, and get healed naturally. Until next time, take care of those hands. They are your connection to this beautiful world. So, see you in the comment section.